But how do you ace it? You've got to be brief and you've got to be specific. So when I say specific, what I mean is, for example, the patient has hypothyroidism. State that the patient has hypothyroidism. Don't state that the patient has thyroid disease. Because there are so many thyroid diseases, right? Is it a multinodular goiter? Is it like Hashimoto's thyroiditis? Is it hyperthyroidism? Is it hypothyroidism? So make sure that you are writing the specific condition, not just something which is bleak and which is vague. Now, the other question you also have to ask yourself is, this question I'm dealing with, is it asking me about a drug class or it's asking me about a drug name? Is it asking me about a drug class or it's asking me about a drug name? If it's a drug class, provide a drug class. If it's a drug name, provide a drug name. The next thing, what you can do to ace this exam is don't provide a range. So, there are some medications that you can prescribe for 5 days, you can prescribe for 3 days, or you can even prescribe for 7 days. Don't write, say, 5 to 7 days. Rather, if you are sure and you want to write maybe this particular medication for 5 days, just write 5 days. If it's also want to write it for 7 days, just write for 7 days. Don't write a range. That's all I'm saying. What about spelling mistakes? You will not be marked for a spelling, you will not be marked wrong for a spelling mistake so far as the examiner is able to make out what you're trying to say. Okay, so for example, if you're trying to spell hydrochlorothiazide and you forget maybe the I, you're not going to be marked wrong because we can tell that you are trying to write hydrochlorothiazide. And what about abbreviations? Only use abbreviations which are commonly known across board in Canada. Only use abbreviations which are commonly known across board in Canada. So which books should you use in this particular exam? There's a book or there's a website called Canadian Patient Safety Institute. So when it comes to the safety issues, that's the book you need to use, okay? And then there's also another book called The Safety Competencies Enhancing Patient Safety Across the Health Professions. That's the book you need to use. And then, we also have WHO WHO guidelines as well. And then there's this book from the Alberta Health Service. It's called Bugs and Drugs. Bugs and Drugs. Bugs and Drugs. Awesome book. And then, of course, the almighty Up to Date. Okay. And then we also have Public Health Agency of Canada. If you want to master the infectious diseases part, that is one book you want to focus, or one area you want to focus on. As well as when it comes to immunizations, you also want to go back to the Public Health Agency of Canada, the immunization portal. And then College of Family Physicians, they have what you call priority topics and key features. Up until 2020, they had 99 topics. But from 2020, they added 6 more topics. So now they have 105 topics. So just go to the CFPC website and then just type in 105 priority topics. 105 priority topics. Everything is there. And then there's also this website called Choosing Wisely. Those who are taking the QE1 with MedCognito will realize that we use Choosing Wisely a lot because it's a very, very important resource, okay? And then we also have Canadian Medical Association Journal and then RX Files. So somebody may be asking, what is RX Files? This is an older version of RX Files, okay? This is an older version of RX Files, and it is written this way. There's a lot of information in there. This is an older version of RX Files, and they have brought in new versions. They have RX Files, geriatrics, RX Files, and at times they even bring out leaflets on specific things like addictions, like diabetes management, all those things, okay? And then last but not the least is the almighty Compendium, this book, Compendium. This is an older version, and this is about 1,741 pages, right? So this is a book you need to use so far as your exam is concerned. And you need to master this book very well to ace the therapeutic decision-making exam. Okay, so now you may be saying, oh my goodness, it's so much information. What am I going to do? No. Don't worry. We have summarized everything for you. Doctors, we've summarized everything for you. And that is why you don't need to worry your head about this at all. So now let's try some questions. I want to know, doctors, please, are you ready to try some questions? Let's try a few questions and then see how the exam is. Okay, so I'm going to read the first question. It says, a 56-year-old patient on pantoprazole for acid reflux and currently on day 7 of a 10-day course of oral ciprofloxacin for an infection comes into the clinic with a history of 4 days of watery, foul-smelling diarrhea. He is hemodynamically stable. Now the question is, what is your diagnosis? Doctors, please type in your answer. Dr. Pamir Popal and Dr. Betty Rivera. So now we are doing therapeutic decision making. Okay, type in your answer. 56-year-old patient on pantoprazole for acid reflux and currently on day 7 of a 10-day course of oral cipro for an infection comes into the clinic with a history of 4 days of watery, foul-smelling diarrhea. He is hemodynamically stable. What is your diagnosis? What is your diagnosis? What is your diagnosis, doctors? What is your diagnosis? What is your diagnosis? Please type in your answer, type in your answer, type in your answer. Let's go. The patient is doing 10 days of Cipro. He's already done 7 days. And the patient has come in with 4 days of foul-smelling watery diarrhea. Doctors, what is your answer? I want to see the answers you are going to produce. Okay, so the answers are flowing in. So I'm going to say this is a typical presentation of Clostridium difficile.